Hello, everyone. I think it's probably a good idea to get started since we've got a lot to get through in a relatively short amount of time. I'd like to welcome you all to this Stats Café webinar on using secondary data sources for inequality assessments. This is our second event in a wider series of webinars and expert group meetings on inequality assessments under the title Inequalities in CRVS. Let's really get everyone in the picture. My name is Petra Nahmias and I am the Chief of the Social Statistics section at ESCAP based here in Bangkok, and I'll be moderating this webinar. A couple of housekeeping items. We request that if you're not a panelist, that you please keep your camera off and your microphone on mute unless you are speaking. This webinar is also being recorded and we will make the recording available and the presentations available on the website. If you have any questions or comments, we invite you to write them in the chat function, which we'll be monitoring. We're really delighted to have such a large number of participants at this webinar, which is reflecting the importance of inequality assessments and the interest in this work. We know that people who are not included in CRVS systems are not only left behind, they're not visible. And since they're often the most marginalized and vulnerable, being left out of these systems just compounds this marginalization and vulnerability, which just emphasizes how important it is to be able to measure whether they're included, because if we can't measure it, then we can't see if policies for improving CRVS systems are really working and what progress is being made. And we know that inequality assessments are very hard to do just because there is such a difficulty in getting hold of the data. But few countries are going to have the resources to undertake primary data collection just to address inequality assessment. And indeed, we wouldn't recommend this unless absolutely necessary due to the resources required in doing so, which means it's incumbent on us to explore secondary data sources to try to assess inequality as an important first step. And this can be directly done through questions on registration in these different data sources, or as a means to estimate the vital events, such as births and deaths, among certain populations, in order to be able to calculate completeness and coverage for the different populations, rather than just having a national average. So in this webinar, we're going to look at 4 key secondary data sources which can potentially be used in inequality assessments. We're going to start with censuses, then household surveys, followed by administrative data, and then data from sample surveillance or registration sites. We're very lucky to have with us an outstanding panel of presenters and discussants. However, I think we did get a little bit ambitious about what we can realistically fit into 90 minutes. Therefore, I would ask the speakers and discussants to kindly stick to the time constraints. When you have 1 minute left, I'll switch on my camera. So when you see me appear, you'll know it's time to begin to wrap up. And I will need to be a bit rude and interrupt if you go over the time, or we just might not be able to fit everything into our 90 minutes. However, the good news is that this webinar is going to be followed by 2 half-day expert group meetings later this week. So any issues raised, we're going to have ample time to expand on in that forum. So without further ado, I'd like to move to our first presentation on censuses. This will be presented by Mr. Sergen Merchik, Chief of the Demographic Statistics section of UNSD, and particular thanks to Sergen, for whom this is the middle of the night. So Sergen, over to you. Sergen, are you able to share your presentation?
So, Petra, can you hear me?
Yes, we can hear you.
Very well. So I apologize. I do have an issue here with my computer that is not behaving as it is supposed to behave. Could they please go to the second presentation until I fix this one up, and then we can go back to the.
All right. So let's move on to our second section. We'll come back to censuses, and this one is on household surveys. We'd like to begin with Mr. Jay Vasudevan, who is the Regional Statistics and Monitoring Expert and Coordinator for the Multiple Indicator Cluster Surveys at UNICEF. So Jay, would you like to present now?
Thank you very much. I'll be sharing the screen. Can you see the screen? Could you please confirm?
Yes, now we can see it. It's just come up.
Okay, thank you very much. Good morning, good afternoon, good evening, everybody, and thanks for joining this webinar. So I will be briefly talking about using household survey data to assess the inequality in birth registration. I will not go into other CRVS aspects. And in this also, I'll be primarily focusing on the multiple indicator cluster surveys and a little bit demographic health surveys. So in this presentation, I will just share the coverage of mix and DHS and the history of it a bit so that everybody gets the background of it. And then how birth registration data is collected through these surveys, and then power of household surveys, survey data in terms of understanding the inequality. And I will also share some examples. And then I will go into a little bit in terms of sharing some of the advantages, disadvantages of these household surveys and household survey data in general. And I will also try to bring up some of the thoughts and way forward. Okay, when it comes to background and coverage of the multiple indicator cluster surveys and demographical surveys, the mix, in short, that is multiple indicator cluster surveys, started like early 1990s, initiated by UNICEF. It started to measure the progress of the CRC to set a baseline and to track the progress. And globally, 115 countries have conducted mix so far. And when it comes to Asia Pacific region, more than 30 countries. And the same statistics are below for the DHS as well. DHS started mid-1980s, and globally more than 90 countries have conducted one or more DHS. And when it comes to Asia Pacific region, more than 20 countries have conducted one or more DHS. So these surveys normally conducted like every 4 to 5 years in most of the countries. There are exceptions as well. In some countries, they also do every 3 years. So these surveys, especially the mix, are conducted at national level as well as subnational level. And the birth registration, I think we all know that it is the SDG indicator 1691, and it is basically the trying to measure the birth registration among children under 5 years. So the questions asked or included in the survey are very simple, and they are not very complicated. These also evolved over a time period, and I have just included to give an impression in terms of what is included in the survey questionnaire from the mix as well as the DHS. And you can see from the questionnaire itself, these questionnaires needs to be customized to the local context to include the type of the certificates and what kind of mechanism they have in the country to capture the correct information. So if you are not customizing the questionnaire properly, we will not be able to measure the birth registration accurately. So it is very clear that the questions are simple, but we have to be careful when you include this into your own national surveys. In mix and DHS, they are pretty much standard. So we'll be using the standard set of questionnaires. And again, coming to the coverage globally, if you look at the global coverage of birth registration data coming from household surveys, I think if you look at from 1992 up to now, in 1992, there was only one, underdeveloped or developing country with the data on birth registration coming from household surveys. So that number has gone up to 123 in 2020. So there is a increase. You can see how household surveys evolved over time and the coverage of birth registration data from those household surveys. And again, if you look at the Asia Pacific, I think we have 37 countries with data on birth registration coming from household survey data. And all sources, if you put together, there are 48 countries. But still there is a gap, more than 10 countries with no data appearing in the global database when it comes to birth registration. And let us look at the power. There are some advantages, as I mentioned before. Household survey have a lot of power when it comes to data analysis and some kind of advanced analysis. So if you look at that, one important thing is when it comes to birth registration, unlike in some other sources we analyze, it is very easy to analyze because both numerator and denominator comes from the same data set. So for anybody, doing the analysis, there are no complications in terms of managing numerator and denominator issues. That is the case with, admin data or some other data sources we use for, understanding the level of birth registration. And then analyzing inequality, I think I have listed some dimensions here, so I'm not going to read them out because of the time constraints. We can analyze rural-urban differentials, education of the caregiver, by wealth index, migration status, disability, refugee status, and so on and so forth. So this also depends on what you collect as part of the household survey. If you have some specific interest, you have to include that so that we can measure that as well, inequality measurement. And continuing with that, if you know that there are certain things you want to do, then you have to use the advantage of the sample design flexibility that we have in household surveys. Okay, you can oversample some areas, you can include subnational things, you can include backward area, a little bit more sample, even though the population may be small. Likewise, you have plenty of opportunity and options to modify your sample design to drive what you want to get out. And then a couple of other things, going beyond the mere level of birth registration, you can also get the details of possession of the certificates and again knowledge about how to register a birth and so on and so forth.
I'm very sorry, but I'm afraid we're going to have to end now.
Yeah.
1
minute. Yeah, couple of examples when it comes to differentials. So I'm just picking 1 or 2 cases here. This is from Kiribati mix. It is coming from the Pacific. So I'm just giving the regional differences and urban rural differentials. Here also, this graph is showing registered as well as with the certificate. You can see the difference there when it comes to registered and with certificate. So the same kind of example I have picked from Philippines also, but this is giving the differential of the wealth index differentials. Because of the time, I'm not going into the details. And even in Philippines, if you look at some of the regions, it is much lower. As for example, Mindanao. So some of the advantages of the household survey, as I explained before, it helps easy to analyze, it helps in understanding the inequality and so on and so forth. You also have the sample design flexibility, okay, in terms of managing the data collection or what you want to collect and analyze. Some of the disadvantages, sometimes household surveys omit some vulnerable groups, migrant population and remote areas because of various considerations. So those are some of the disadvantages. And frequency of data collection, because household surveys you cannot do every year. So and then cost also involved in it. And some of the recommended improvements. Okay, I'm finishing this. Okay. This is the last slide. So address the data gap issues, strengthening administrative takes time, so household surveys can play an important role. So I'm not going into the details. Sorry for taking a little bit more time. Over. Thank you.
Apologies from our side because it's so interesting. We could talk for such a long time, but yeah, I'm really sorry. We do need to move on, but we look forward to further discussions in the EGM on this topic. So we'd like to move quickly to our next speaker, and this is going to be finished with the, I think, with the surveys in the first instance, and so we'll move to Ms. Tiraka Chanta Lana Vong, I hope I pronounced that correctly, who's the Director General of the Social Bureau. Ms. Tiraka, over to you.
Okay, thank you very much. Good afternoon, ladies and gentlemen. Can you hear me?
Yes, we can hear, but we don't see the slides.
Okay, please allow me to present our experience with now social indicator survey, the second one in the year 2017. So regarding to your outline, the background of the survey is we call the now social indicator survey 2 in the year 2017. The aim or the focus of the survey is to post the baseline for the 8th National Socio-Economic Development Plan, supported the monitoring of SDG and LDC graduation, and after socio-economic situation of children, adolescents, women, men, and household. Methodology of the survey, it is a sample survey which was designed to provide estimates for a large number of indicators on the situation of children and women at the national level. For urban and rural areas, sample selection has 2 stages. The first stage is select about 1,170 clusters in urban, rural, without road and with road. The second stage, we select the household sample. We got about 23,400 households, and in each cluster we include about 20 households per cluster. The main stakeholder for the survey is Lao Statistics Bureau, comparison with the Ministry of Health, Ministry of Education and Sport. We also received a technical support and financial support from our development partner like UNICEF, UNFPA, USAID, Luxembourg, EU, SDGs, UNDP, JICA, WHO, WFP. So for the output, so we got quite many information from the survey, like a survival of the children or something like that, and also the child development, education or learn, protection from violence and exploration, clean environment, equitable chances of life in life. So from here we receive about 25 indicators to support the SDG. And down to CRVS indicator, we can respond only 1-to-1 goal, like a goal 16, target 9, and indicator 1. That means the overall birth registration rate of children under 5 is 23%. If we compare to the last survey, it was about 75% in the LC1. And only 1 in 10 mothers or caretakers know how to register birth with the civil authorities. And from here we also got about 42 indicators to support our National Socio-Economic Development Plan. So regarding to the advantage and disadvantage of the survey, in the side of advantages, the survey applied the mixed protocol and selection process of modules which need to be included in our survey. The survey also equipped well with the implementing agency by its tools, methodology, protocol, and program. The application of table for data collection went very well. So it was good for the following fieldwork data collection in the next survey as well. So the advantages, as the mix 6 is significantly different from the previous mix. The development of the survey tool and its manual and culture with many challenges. The global mix team made frequent revision on the questionnaire in difficult time. Since the LC1 or LC2, our survey is an earlier survey applied to mix 6 method and procedures. Most of the survey tool, data processing package, and other supporting documents prepared by the global mix team not really available on the time for our survey. So the criteria used in the determining, we use data from the survey census to assess inequality in CRVS because of CRVS is not really complete system in our country yet. Currently, MOHA is the Ministry of Home Affairs is developing the Civil Management Information System. It just do in the pilot 3 provinces like Vientiane Capital and other two provinces, big provinces like the Luang Prabang and Jakarta. Therefore, the data from survey from the census at the current time are the most data that we use to using as a method and implemented stages follow the principle and recommendation of the global standard. So when data use is really appropriate for using, so the data it help us to monitor the sustainable development goal like SDGs, especially key input for the outgoing volunteer national report on the SDG. In the year 2018, we are still continue now, nearly complete by June. And also it's also formulate a baseline for the 8th plan for the National Socio-Economic Development Plan of the Lao PDR and Provincial Development Plan, including the input for the upcoming midterm review of the 8th National Plan. And it also helps to support the data to measure the country graduation from the least development country. So our last slide is the recommendation that how to improve the CRVS in Laos. So we think that improving the CRVS system must be covered in all areas in the countries. And also this can improve the capacity of the authorities to be an appropriate professional such as registration skills and ICT knowledge at local level. The third one, increase attention to the at-risk group and population to register. The last one, we should put more attention to the action plan for compiling, processing, validation, and dissemination of data from CRVS to support National Development Plan and monitoring SDG. This is on our experience to share with you, or you still not really clear something or need to know more. We will be here until the end of the meeting. So thank you very much.
Thank you very much for sharing the experience of Lao PDR. This was very helpful to get the country experiences. And thank you very much for keeping to time. That's much appreciated. We'd like now to go back to Surgeon. Now you're able to connect.
Yes, thank you very much, Petra, and apologies for the technical difficulties that I had initially. It's simply the fact that my computer refused to cooperate. Essentially, I would like to first and foremost to welcome this opportunity and to wish you all a good afternoon in Bangkok and in Asia in principle, and to express my appreciation for having this opportunity to share some of the methods that we have been developing as international standards for assessing the civil registration completeness using population and housing censuses, which is essentially the point of the discussion here. I believe that you can see the slides here. I do have 13 slides. However, I certainly will stick to the allotted time, essentially because the point here is to provide just a kind a framework of what the methods exist, and then certainly do encourage all the participants and the listeners of this webinar to dig deep into it at their own pace. So the point of this presentation is assessing the civil registration completeness using population and housing censuses, and then I would certainly would like to start with the point that has been made just less than a year ago, with the adoption of the UN Legal Identity Agenda, which is a holistic approach to civil registration, vital statistics, and identity management, which is an expansion of the existing methodological frameworks for civil registration, vital statistics, and thus assessing the completeness of civil registration is of particular significance in terms of introducing solutions and achieving universal coverage. This is the ultimate goal of the UN Legal Identity Agenda, ensuring universal coverage of all the vital events that occur in a country and translating them into the regular vital statistics, in the same time ensuring the legal identity for all from birth to death. The two major references that I'm going to use throughout this presentation refer to the United Nations Principles and Recommendations for a Vital Statistics System, Revision 3 from 2014, and then the accompanying volume, which is the Handbook on Civil Registration Vital Statistics System, Management's Operation and Maintenance, Revision 1. So these two are the reference materials for the presentation here. I would like to just point out to the fact that when we talk about the coverage and the completeness of the civil registration, it is not only related to the fact that we can monitor them from the outside and quantify them from some methods that do exist, including the population housing census, but it is also a component of the functioning of those systems themselves. So that means that to assure the quality assurance of the civil registration, we need to have a proper legislative framework. We need to have a very well-developed civil registration infrastructure. We need to have the civil registration protocols and the timelines for the registrations. On top of that, we did develop over time a number of methods for assessing the completeness of civil registration, whether all the vital events that occurred in the country were registered or not. Those two clusters of methods are direct and indirect methods. The indirect methods will be focused upon later on in this webinar. I will focus on the direct methods, which is the use of housing, population housing censuses. Here you have a definition of the population housing census as per the international recommendations. And then we are focusing on a traditional census whereby every household in the country is approached with request to provide information, and that results in the master file that consists of individual records for every single household, individual, and housing unit in a country. So if you look at the further development of the methods for using the population housing census for assessing the completeness of civil registration, they can be segregated into two, the aggregate level and the record linkage. The aggregate level means that we are actually comparing the aggregate data from the censuses against the aggregate data from the civil registration records. And for that, the UN Principles and Recommendations really introduce 4 questions that are critical in terms of using this method. So you have them here in front of you: the children ever born line, the children living, the date of birth of last child born alive, and the household deaths in the past 12 months. If the census follows the international recommendations, the census would collect this information, and then that information would be matched against the aggregates from the vital statistics from very specific area, and that would show the quality of either the census or the civil registration. If there are too much discrepancies, in that case, definitely there will be need to investigate further on. The primary advantage of this method, the aggregate method, is that both civil registration and census produce small area statistics, simplifying the process and enhance the accuracy of the analysis. Of course, the downside is that these methods essentially are that the census is taking place only once in 10 years. And then we have the record leakage, which is the other set of the methods that have been developed by the national practices and then incorporated into the international standards. I'm not going to go again into details. This presentation will be available online. The point here is that we need to have a clear understanding that there are some prerequisites necessary for matching the records from the civil registration against those from the census, and this is the compatibility of population coverage. Unique identifier would be an absolute advantage of it. However, we do have two approaches to this. The use.
Wrap up, please.
I'm sorry?
Could you kindly wrap up, please?
Yes. So we do have the deterministic approach, the method that would then match exactly the records from the civil registration against those from the census. And then this is a method that I'm not going to go into details. It will be available for you to go into details once it is posted online. And then we have a probabilistic method that essentially is the one that doesn't use the exact variables from the both set of records, but that allows the probabilistic approach to assessing the coverage or the completeness of civil registration against those from the census. So, in very short, the point is that you can use the census in many different ways. The point is that also this is something that is quite available at this point of time, and this is something that we encourage to be done as a routine exercise in all the countries. Thank you, and over.
Thank you very much, Surgeon. And again, apologies for so rudely interrupting you when it's such an interesting topic, but unfortunately we do need to move on. I'd like to now invite Ms. Gloria Matenge, who is an advisor on the CRVS systems at the Pacific Community, to provide some thoughts on the last presentations. Gloria, over to you. You're on mute, Gloria. Okay, thanks.
Can you hear me?
Yes.
Okay, thank you. Thank you, Petra, and thank you very much for the invitation to be the discussant for the session. And I thank our presenters for the very enlightening presentations. Of course, through the presentations, we have covered the extent to which household surveys and censuses can support assessments of inequalities of civil registration systems. And I will just discuss through a few points that emerge from the session. So first of all, as we all know, the primary purpose of civil registration is to get legal documents which can be used, which are provided for under the law, and secondly, deriving vital statistics. So for registered, so what primarily we are aiming at is having a complete registration system where all vital events are registered and where we have vital statistics that are representative of the population. When we talk of inequality assessments, many times we think about getting an understanding of the populations that are not being registered. And as we saw in the previous webinar, there are population groups that might be at risk of not being registered. For instance, refugees, internally displaced people, and so on. But a fundamental approach to an inequality assessment, which is important to keep in mind, is that it's not just about establishing which populations are not being registered, but understanding why they are not being registered. It is from this understanding that we can be able to make valuable conclusions about how to address the issue so that it's not a recurring issue. This means that assessments should endeavor to reach to the underlying reason behind underperformance. In undertaking inequality assessments of CRVS systems, we see from the presentations that a two-pronged approach is necessary. In the first approach, as stated by the first speaker, we need to look into the weaknesses that emerge from the design of the civil registration in itself that would render it discriminative. Therefore, undertaking a quality evaluation of the CRVS system is important. And this quality evaluation will investigate aspects such as the legislation, the administrative aspects, and so on. This nature of assessments will help us derive information about the civil registration, why the civil registration in itself is not functioning properly and therefore could be discriminative. There are a number of tools that have been developed by partners to support these kinds of assessments, and you may be aware of the WHO Rapid Assessment and Comprehensive Assessment tools, the CRVS Improvement Framework, and other thematic tools that have been developed by partners. Countries in this region have included comprehensive assessments as a priority in the Regional Action Framework, and it is important that these assessments are recognized as an integral part of inequality assessments. Our presenters also spoke to the second approach to undertaking an inequality assessment, which entails evaluating available data for completeness. And completeness in this case, of course, refers to the number of vital events that are registered by the CRVS system as a total of the estimated number of vital events that would have occurred within the population. From their presentations, we saw that censuses and surveys provide data that will help assist countries in such inequality assessments. In the case of surveys, we see that mixed and DHS surveys are the most common surveys applied globally, and these surveys include a question about the registration and possession of a birth certificate. And then these surveys also provide an opportunity to analyze data in a more in-depth way. And we also saw their limitations, which could be due to, which are associated with their costs and them not being frequent. I would also add to that and using surveys for this kind of assessments can be limited by how that question is understood by the interviewer and also the interviewee. Then from our first presenter, we also saw that population censuses are an important tool for assessing completeness of the CRVS system, and the assessments can be done at an aggregate level and also through probabilistic and deterministic record linkage methods. So in conclusion, what I would say is that, of course, inequality assessments are very necessary in fulfillment of the UN legal identity agenda, and of course for us to achieve the full purpose of the CRVS systems. We have censuses and surveys, which are very valuable tools in supporting us to get the data for this kind of assessments. And these data sources can also provide data to help validate civil registration data. The presentations demonstrate that there are methodologies that exist on how to use existing data sources to conduct assessments. And we learned of the UN principles and recommendations on vital statistics and the handbook on civil registration management and operations, which provide countries with robust guidance on this. Through surveys, we see that birth registration data has been analyzed in many countries, at least at an aggregate level. However, from my perspective, I see there appears to be a lag in death registration in as far as analysis is concerned, and this could be due to the complexity of the methods that are applied in such assessments, and this will help us think about what kind of support that countries might need at this time. In the Pacific, we also see increasingly countries are including birth registration questions in the census, and this is becoming a very popular activity. Then finally, when thinking of inequality assessments, like I mentioned in the introduction, it is important that we think about the system-wide issues. So we should talk about the CRVS assessments as we knew them before, but then we also need to think about what the data is talking about. And for the population groups that are excluded, it will be useful to ensure that we interview them further to understand what is the reason behind non-registration. Thank you very much.
Thank you, Gloria, for those points. We look for, I think we could have spent the entire cafe talking about them, but we will, I think, definitely make sure we go over them in the expert group meeting. So now this ends part 1 and 2. We are going to move now to part 3, which is looking at administrative data. We're going to begin with Dr. Chalapati Rao, who is a professor at the Department of Global Health at Australian National University, with a research interest in the collection, evaluation and analysis of mortality data. So Chalapati, over to you.
Yes, thank you, Petra. I'm just trying to get my screen up with the slides. Just give me a second. Are my slides visible now?
We can see the slides not in slideshow mode though.
Okay. How about now?
Yes, now it's fine.
Okay, good. Thank you. So good day and good evening to all. And at first, I'd like to thank ESCAP for inviting me to participate in this webinar. I think the background and context of the presentation are already known to all. They've been covered by previous speakers as well as the introduction in regard to the importance of measuring inequalities in access to civil registration and vital statistics, civil registration services, particularly for birth registration. You were talking in terms of differences in completeness of death registration rather than inequalities in that sense. So to measure the inequalities in birth registration, there are a range of administrative data sources. So by administrative data sources, we mean the kinds of record-keeping systems that operate on a routine basis and are maintained with a mandate by respective organizations to continuously collect this data. So there are four broad families or groups of administrative data sources which we could consider and each of them have their own characteristics or types and their advantages and disadvantages. For instance, health records usually are in the form of birth registers or immunization records or registers that collect or record information on nutritional support. The advantages are that they usually have an unbiased recording of service recipients and are recorded in a timely manner, but they tend to exclude the private or informal sectors, therefore it's an incomplete coverage. We also have locally maintained administrative records in the form of village household registers or local family planning programs maintained by the government or school enrollments. And they are socially accepted, but they often have limited variables that are recorded for these in these record-keeping systems. A third source are the government programs for income support or identity management. They potentially have good population coverage and sometimes are available electronically, which makes it easier for the analysis, but they could exclude marginalized groups or migrants. And there could be sometimes questionable validity of the records because of poor updating of the record-keeping practices. The fourth source are international program data, which maintain registers on refugees. You have the UNHCR records in defined refugee populations, aid programs, and non-governmental organizations that provide services to these groups. So they are known for having accurate data and they have a specific focus for recording these information. But they, as we can understand, have a limited population coverage because they are targeted. And sometimes there's a program uncertainty which affects the continuity of recording. Now, how do we assess the inequalities? Sarjan had already covered the themes in terms of the aggregated analysis and the second form in terms of record linkage, which is by matching the records from the civil registration system with the records in the administrative data source of interest and identifying those records that are matched in both systems and those that are unique in either system. And then you can estimate a denominator for the study population either through data reconciliation or by applying statistical methods which are known as the capture-recapture methods or a combination of both. So the CRVS events are used as the numerator to evaluate the proportion of the registered events for the study population of interest. and thereby you can measure the rate or of the completeness for that population and compare it with that for the general population or any other comparator. When are such data sources appropriate to be used? So the experience has generally been that to measure geographical inequalities, health records or local records might be more appropriate given their broad dispersion across the whole population. For socioeconomic inequalities, you might want to use government program data or NGO records. And this is because health and local records usually do not include socioeconomic variables. And for marginalized groups, you would need to use refugee records or aid program records. In terms of measuring or comparing completeness of death registration, there are also a range of administrative data sources, mostly from the health sector, in terms of hospital mortality records or health center records or disease surveillance program systems for specific diseases, cancers, etc. You could use the police records for deaths from injuries. Sometimes you can use health insurance databases, but it's usually difficult to get access. And then you have the identity management programs. And there are similar measurement methods in terms of aggregated analysis or record linkage. And finally, how do we improve the measurement of inequalities? The most important issue is to try to improve the data quality from each administrative data source, which will give you a better handle in establishing the rates in the two groups. And to improve the routine system, you should promote data matching, reconciliation, and verification at the local level across the different systems on a routine basis. This will reduce inequalities in registration while also enhancing overall data completeness. Thank you.
Thank you very much, Chalapati, and also thank you very much for keeping to the time constraints. Next, we would like to invite a joint presentation from James Einstone-Hinkins and Lauren Moran. And they work for the Australian Bureau of Statistics, where they lead the collection of births and deaths data and the production of the national mortality data set. So James and Lauren, over to you.
Thanks very much, Petra, and thank you for the opportunity to talk with everyone today. This will be the shortest shared presentation of all time, I'm quite sure. And we're going to cheat a little bit because we're actually going to talk a little bit about census and other admin data sources. But I suppose if there was something that we really wanted to draw out today, it was more or less to come from a position of a national statistical office and the role that we have in terms of using data to inform really important policy or other research studies, and the way in which we need to work with the registries of births, deaths and marriages to ensure that we do that as best as possible. We're very lucky in Australia to have very high rates of registration, very good quality data to work with, but we certainly recognise that the data is not perfect. And it's really important to be able to understand where it is not so good so that you can do as much as possible to try and overcome any of those limitations of the data set. Of course, it's the role of registrars and the registries themselves to work with communities. They have lots of community outreach work, community engagement, and also strategies around trying to improve access to data that are all about trying to either speed up registration or ensure that there is full registration, both for births and deaths. So understanding those systems is really important. So as I say, once we are able to understand those limitations, we can put in place strategies to try and improve those. The use of those data sets and alternative data sources are really important to that end. We're just going to talk very quickly about two examples. So I'm going to hand over to Lauren to quickly talk about a census data enhancement project.
Excellent. Thanks, James. So I will very quickly run through the Census Data Enhancement Project. So this was a big linkage study that the ABS undertook. And the first time that we undertook it, it really was not aimed at assessing inequality. Instead, it was much more around enhancing the deaths data set that existed. And that is a very large administrative data set that we do receive from the registries of births, deaths and marriages. And because it's very well known in Australia that our Aboriginal and Torres Strait Islander people are less represented in our civil registration data set, and that's for both births and deaths. And it's not especially that they may not be registered, but it is also around those appropriate identification methods in that process of birth or death registration. And so it was really quite a large flagship study to see if we could actually enhance the data. And although we know that some of those rates are lower, we're still putting out really good information around population and health. So good policies and interventions could be made for Aboriginal and Torres Strait Islander people. And this one was especially aimed at life expectancy. So we took the deaths data and we linked it to the census data, and that was by date of birth, date of death, where people lived, and a whole range of variables. So we pretty much got a very, very close linkage. So we knew that it was the same people. And we had a look at how people identified on the census, because they had self-identified as to whether they were Aboriginal or Torres Strait Islander, and how that was recorded on their death registration. And what was really a secondary byproduct of the process is that we realised with this data linkage project that we were able to see where some of those rates of under registration were happening for Aboriginal and Torres Strait Islander people. And we were able to put together some aggregate statistics and feed these things back to the registry. So it's a little bit about the, not so much, sorry, about the assessment of inequality to registration, but it's about how us as a statistical agency continue to play a part in that process by using that deaths data set to feed information back. So some of the advantages clearly is that we were still able to get that data out, but it also raised the question for bigger data sets that we could have a look at with data linkage. So this project has been completed quite a few times now, and each time we get a little bit more insight into some of those registration patterns. And I'm just going to hand back to James for births, but that's all we really wanted to say on the deaths part.
Yeah, so thanks, Lauren, and very quickly, sorry, I didn't mean to move on the slide there, so I cut you off a little. But anyway, there are other ways in which assessments of registration data can occur, and other ways that alternative data sets might be used to enhance registration for people throughout any given country. Very quickly, just want to talk about a project that is actually underway in Australia. It's called the Birth of a Child Project. But what it effectively does is it recognises the synergies between both the birth registration data and also other key administrative data sets in Australia, the Medicare and the Centrelink data sets. Those three, I guess those three key services that are things that every mother in Australia needs to enrol with. And the aim of this project is to try and bundle servicing for all three of those. And effectively what it would mean is that a mother fills out one form, or perhaps works with a particular phone app or something like that. And that then allows them to enrol with Centrelink, with Medicare, and to complete their birth registration. It's a very useful approach because it effectively means that incentives for any one of those three enrolments with government services are shared across those three key those three areas. And effectively, this could actually seriously improve the timeliness of birth registration, and where there may be some undercoverage could also prevent that undercoverage. So it's a really interesting project. I guess it will take some time. And what we really know in the meantime is that with the synergies between those three data sets, there are opportunities to use that to better be able to understand where there might be especially longer lags between when a birth occurs and when the registration occurs, because we know that connections with government occur earlier with some of those other data sets. So we're not quite there yet. What's really what needs to underpin this is agencies being able to work together. Obviously, data custodians working together, good engagement, good trust, and therefore the potential to be able to bring those data sets together, link, and to be able to feed back that information to registries, because as they work on their community engagement to try and improve registration services for all people, the sort of information that we can draw out of these sorts of studies would be incredibly useful. So we might just leave it there. Thank you.
Thank you very much. You know, for us, I think it's really useful to have a country like Australia, which has got high registration rates, and to see that actually there's also populations that are left behind, and the need for inequality assessments in every context. So thank you very much for that. So we'd like to now move on to that final section, which is looking at sample surveillance and registration sites. And so our next presenter is Dr. Olga Hughes. I think is another person we have to thank for staying up very late into the early hours of the morning. And she is a technical advisor in the CRVS team at the CDC Foundation. So Olga, over to you.
Okay, one moment. Let's see. Can you see my screen now?
Yes. Yeah.
Yes. Okay, wonderful. Great. So thank you to everyone for participating in today's webinar on such an important topic, as it's critical for civil registration and vital statistics systems to get everyone in the picture. And also thank you for the organizers for giving me a chance to present on the Indian sample registration system. Which, as you can see here, aims to provide reliable annual estimates of vital statistics for the states and the country on the basis of a probability sample. And India is a very large and diverse country with an estimated population of just under 1.4 billion in 2019, according to World Bank estimates. And the civil registration system is decentralized and does not capture all births and deaths. So starting in the 1960s, or really in the 1970s, the Office of the Registrar General and Census Commissioner supported the implementation of the sample registration system, which I will call SRS for short. You can see that this system is based on dual recording of births and deaths in representative sample units all over the country. And as outputs, the Office of the Registrar General produces key demographic estimates on population composition, fertility, and mortality. It produces life tables and additional detailed tabulations as well. Here you can see the SRS indicator categories, the statistics produced, and their location in the annual reports. And I've included citations for those of you interested in looking at this information in more detail. Let me tell you about the advantage of the SRS as a system, not specifically as a system for assessing inequalities in the Indian civil registration system. First of all, the SRS is considered a reliable and trusted source of fertility and mortality statistics since the 1970s. The Office of the Registrar General prepares relatively timely reports, published usually within 2 years of data collection, and also regularly publishes them with some exceptions. The probability sample covers only about 0.6% of the population, but it's drawn in such a way for the SRS to produce national and state level estimates, although for states and territories with a population greater than 10 million. So that excludes about 8 of the 28 states and most of the union territories, as they have a population of less than 10 million. Now, the disadvantages of the SRS for assessing inequalities in the civil registration system are specifically that the SRS is designed for vital statistics. So the breadth of indicators, such as those that may be captured in HDSS, which we'll hear about in a moment, or household surveys, which we heard about earlier, focusing on specific populations or underrepresented populations, that's quite limited in the SRS. Additionally, data availability for research and more in-depth studies is limited. Access to information is in the form of reports produced by the Office of the Registrar General. There are many criteria to determine the appropriateness of data sources for assessing inequalities in CRVS, but I'm just going to focus on two that are pertinent to the SRS system. Relevance of indicators. So as I've noted, the breadth of indicators captured in the SRS is limited to fertility, mortality, and some medical access indicators. And the other criteria is timeliness of analyses, and that's where the SRS performs quite well. The SRS would be appropriate in conducting an inequality assessment focusing on age and sex, as I'll show you in a moment. And analyses can be done on quite recent data, since the Office of the Registrar General works to produce reports and disseminate them within a short period of time. So here you can see that the Office of the Registrar General website has already made available the 2018 annual CRVS report and the May 2020 SRS bulletin. In a recent study on the completeness of death registration in the Indian civil registration system, using the SRS mortality estimates as a denominator, researchers from the Public Health Foundation of India and the University of Washington estimated registration completeness with additional analyses on non-availability of age for registered deaths, which in 2015 was around 38%, and non-availability of sex for registered deaths as well. These researchers could not disaggregate non-availability further by sex and age groups, since the SRS does not provide the number of estimated deaths by age and sex categories that were needed for these calculations. So this points to the limitation of data availability only in the form of reports and specified tabulations. So in brief, the SRS is a very reliable and trusted source of fertility and mortality statistics in India, as well as in China, where, which also operates an SRS. To improve the use of SRS as a data source to conduct inequality assessments, it would be beneficial to have more indicators than those currently available, but then that goes beyond the SRS's focus of fertility and mortality statistics. Although reports are made available by the Office of the Registrar General, it would be beneficial to ensure that all reports are available within the 2-year period and to allow researchers access to the data for additional analyses. Finally, to ensure that the SRS is in fact a source of complete and accurate fertility and mortality statistics, it would be beneficial for the Office of the Chief Registrar to conduct regular evaluations to confirm the completeness of registration in the SRS for the calculation of these important vital statistics. And with that, I'll conclude my presentation for today. So please consider looking at the sources I've cited in this presentation for additional information on the SRS. Thanks so much.
Thank you very much, Olga. The example from India. We'd like to now move over to Dr. Don de Savigny, who is Professor of Health Systems and Policies Research at the Swiss Tropical and Public Health Institute. And we'd also like to appreciate getting up at such an early hour to participate in this webinar. So Don, over to you. Don, are you able to?
Yes, can you hear me?
Yes.
Thanks, Petra.
Okay, yes.
And thanks to David. If David could share my slides. That's great. Well, thanks to ESCAP for including this topic of health and demographic surveillance sites as potential secondary sources for inequality assessments and civil registration, because this is really an overlooked opportunity. It's limited, but it's for some countries it could be a very potent source of secondary data. So this is work that was done with the Bloomberg Data for Health partnership with the University of Melbourne and the In-Depth Network. The In-Depth Network is this network of about almost 60 health and demographic surveillance sites. These are population observatories around the world in low and middle income countries, which have the task of really documenting births, deaths, and causes of death, not registering them, but documenting them. And so we have this situation where two enterprises are doing the same thing, CRVS in the country doing births, deaths, and causes of death, and these population observatories doing the same thing. Unfortunately, there's very little crosstalk between these systems. And so this project was an attempt to see if we could learn from each other in assessing particularly inequalities in CRVS performance. So there's really untapped potential for synergies between these sites and national CRVS systems, because they can provide the gold standard in CRVS denominators on a continuous basis, because they're longitudinal surveillance systems for completeness estimates for birth and death registration, particularly in disadvantaged populations, because most of these sites are in remote rural or in unofficial urban populations in low-income countries. So we can use them to assess any inequities in CRVS performance by age, sex, socioeconomic status, and a number of other characteristics, and also to determine some of the, measure some of the determinants of non-registration and provide some comparative cost-specific mortality fractions in verbal autopsy with CRVS systems, which are also starting to add verbal autopsy. Next slide, please. So for those of you who are not familiar with these population and health observatories, some of them are around, especially in the Asia Pacific region for decades. The oldest ones go back to the 1960s. And they start really with one initial census, creates a cohort, which then becomes a dynamic cohort. The only way you can get into the cohort is to be born into it or migrate in. The only way to get out is to die or migrate out. And this is continually monitored by cycles of re-enumeration. Next slide, please. And this gives certain advantages because they're based on prospective repeated household visits, at least one per year, ideally up to 3 enumeration visits per year in these neglected populations. And they also do pregnancy registration, which gives you a much more accurate documentation of outcomes of pregnancy, whether it's abortion, stillbirths, or live births. And this is very useful for assessing birth registration. And there's huge, deep context collected around these households because they're monitored continuously for environmental issues, socioeconomic status, geolocation, and so on. So a lot is known about the circumstances of the household and the members of the household, immunization status, education, etc., etc. The disadvantage is that they're relatively small sentinel populations, usually around 100,000, some are up to over 250,000 population, but in a confined area. So there's all continuous area that's not sampled. It's everyone in the DSS is in the frame. Unfortunately, in ESCAP countries, there's only 7 countries with 14 sites, but these sites are potentially very useful to those countries in assessing inequalities in CRVS. Next slide, please. Here's some examples from African DSS sites. You can see from the Rufiji one in Tanzania that looking at CRVS only, we only picked up 28% of the births that were actually detected by the surveillance system in a 6-month period, and only 2% of the deaths that were documented in that same area in the 6-month period. And another example from South Africa, going over 25 years, looking at the socioeconomic status of, in this case, death registration. So you can see how it's improved slowly over the 25 years from about 20-point spread between the poorest and the least poor in the 1990s to a much more even spread, but still some disadvantage on socioeconomic status, but a much improved coverage or completeness of death registration documented over time by the DSS site, working closely with Statistics South Africa. Next slide, please. So what if you're going to use these sites to assess your CRVS, you would want to pick sites which update their socioeconomic status annually, sites which do at least 1 census re-enumeration each year, ideally 3 to get pregnancy outcomes, sites with strong migration tracking because the denominators are driven a lot by migration in and out, and that has to be tracked very well if you're going to have a good assessment of completeness. And sites with at least 50,000 individuals under prospective surveillance, and most sites are at least that big. So next slide, yeah. So any country hosting a DSS site could do this. This could be very useful for comprehensive assessments or when monitoring improvements in CRVS when CRVS completeness is at low level. You can use them also for piloting CRVS innovations within the sites before going nationwide. Things like how to do death notification for community deaths could be much easier to work out within a site where you have all this rich contextual data and ability to follow populations. And you can evaluate CRVS verbal autopsy in non-adjacent areas to the HDSS site. So last slide, please. So what came out of our look into all these sites is that very few of them have any linkage with the CRVS system in the country, which is really perverse since they have a common purpose of documenting these births and deaths and causes of deaths. But very few sites have routine collaboration. We found only about 5 HDSS sites that are routinely talking to CRVS systems locally or at the country level. Now, there's a lot of mutually productive synergies if these two enterprises could be closer together. Simple things could be done, such as co-membership on CRVS national steering committees and on the HDSS steering committees, just some cross-membership there. Some starter projects, which I just like the ones I showed you, looking at completeness and the context, and particularly the determinants of non-registration of births and deaths, particularly in these marginal populations. These are the hardest to reach populations where these HDSS sites exist, so they're very useful for looking at the worst case situation. Also for comparing and assessing quality of cause of death data, because the intensity of effort in an HDSS site is very high. The experience with doing verbal autopsy, for example, is there for a long term, and so there's a lot of advantages in assessing the cross determining the mortality data in these sites with what's seen in CRVS. And you could also do annual catch-up registration. There's a lot of missed births and deaths that are seen in the DSS sites. At the end of the year, these could be all turned over to CRVS for registration and catch-up. But most importantly, there's a lot of skills and this experience and expertise and large teams working in HDSS sites that could be shared with CRVS and vice versa, with CRVS experiences can be shared in these HDSS sites. So there's a lot that could be done. It's not being done. These enterprises work in their own solitudes, in their own silos, with very little sharing going on. And particularly in areas, if any country has a site or multiple sites, it's really worth talking to the sites to have a look at just how well, for example, the easiest thing is looking at completeness of births and deaths registration is going on in those remote areas. So that's all I have. We have a publication on this with a lot more ideas of how HDSS populations observatories could work closer, more closely with CRVS authorities and for mutual benefit. Thank you very much.
Thank you. Thank you very much, Don. I think in our region, there's definitely potential for taking this further and learning a lot perhaps from the African experience. So I'd like to now invite Ms. Kala Abduzah to provide some reflections on parts 3 and 4. Kala is the CRVS Country Advisor for Vital Strategies. And Kala, the floor is yours.
Thank you very much, Petra, and thank you to all of the presenters. It's been a fascinating session. I know that we're running a little bit behind time, so I'm going to have a very brief set of comments. I think what we've learned from sessions 3 and 4 is that all of these secondary sources have the potential to eliminate possible disparities in relation to birth and death registration, but all have a number of weaknesses. So the administrative data sources, there are many, as Chalapati pointed out, but while there are many, there are also a number of issues around data quality. If you look particularly within the health sector, health records tend to be maintained by different health programs, seldom combined in any unified way, and this makes analysis particularly difficult. We did see the potential of using administrative records from the example provided by Australia, but even in Australia it's a challenge. So I think we need to do more work on this, and I think possibly we need to investigate more the potential of having unique health identifiers or indeed unique IDs within administrative data systems that potentially could be linked to civil registration records in order to identify possible disparities. So it's a good potential source, but I think a lot more work needs to be done. On sample registration and routine surveillance systems, as Don was mentioning, the sample registration system in India is a potentially hugely valuable resource. But I think both of these data sources, the big advantage is that they can identify other disaggregations that are not captured in routine records. In particular, those related to household income, educational status, possibly also ethnicity, and so on. So the India sample survey system could potentially highlight some of these, as could the health and demographic surveillance sites. The health and demographic surveillance sites, of course, are not nationally representative, but I think the potential of using these sites to kind of test local civil registration completeness, and in particular its ability to capture some of these marginalized groups, really should be examined. But we have to remember again that health and demographic surveillance sites are funded differently. They're not generally government projects. They're often funded by external donors, sometimes focused on particular aspects of health. So again, it's not an easy thing to use them, but I think we certainly should explore those potentials a lot more. I think in conclusion, what we've learned is that certain disaggregations are much easier, certain disparities are much easier to identify than others. Age and sex is the logical first step, because all of the data sources can identify disparities in these areas, and possibly in geographic region as well, from both administrative and survey-based sources. But when it comes to some of those populations that are most likely to be excluded from CRVS systems, they're also the least likely to be excluded in both administrative and possibly also in the sample registration systems. And I'm thinking in particular of refugees, non-national people who need still to register their births and deaths but may be excluded, unmarried women, for example, street dwellers, ethnic and religious minorities. And perhaps we need to complement all of this work with some use of more qualitative type of information. For example, just looking at a legal or the regulatory framework for civil registration can identify right away certain groups that are excluded almost by design. Thinking, for example, the difficulty that non-nationals may have in registering their births, notwithstanding the recommendations of the UN principles and recommendations. A final thought is that I think for all of the examples we've seen in sessions 3 and 4, it's clear that there's a lot more availability of secondary data sources for births than there are for deaths. For deaths, we had a number of potential sources, such as health records is the most obvious, logical one. Chalapati suggested also police records. But we may need to explore further and perhaps go to some less formal record-keeping systems, such as burial records, which I know that this has been used in some countries, records maintained by religious authorities. Insurance records, as Chalipati mentioned, is a possibility, but presents a number of ethical and operational challenges, I think. So my overall conclusion is we should be using all of these potential sources to the maximum of their capability. But remember that we still have a long way to go in really identifying the most excluded groups. And perhaps we could use this idea of working with the health and demographic surveillance sites to really try and explore that more fully, and to explore the, I think we need systematically to try and seize every option to either do probabilistic linking or deterministic linking of some of our secondary data sources with the civil registration system for further study. Thank you very much.
Thank you, Carla, for those very insightful comments. I'm not sure I could be so coherent at 5 o'clock in the morning, so thank you for that. I'd really like to thank all the panelists and discussants for such excellent contributions, especially those who are based in the US and stayed up very late, or in Europe have got up very early. We'd now like to open the floor for any questions. And what we would like to do is, if you could, just to make it more manageable, if you could please type your comments in your questions or comments in the chat box, and we will come to that. We won't be doing any audio questions, any spoken questions. So I'm going to go to working up the list to a question from Sarah Habibia, and that's asking about data quality and data completeness in surveys such as DHS in lower and middle income countries. And I think maybe I could invite our delegate from Lao PDR to perhaps address the issue of ensuring data quality and data completeness in surveys such as DHS. So Ms. Tiraka, are you able to address this question?
Yes, thank you very much. So would you like to hear from me about data completeness from the survey, right?
The question is, how do countries, lower middle income countries, how do you ensure data completeness and quality in the DHS?
Oh, yeah. Actually, we are still would like to know more from the expert as well. That even though we have the mixed and expert come to help us in design questionnaire and selecting the sample size, but we still worry about the content when we put in the questionnaire. I think I'm not really 100% sure that our data it's really completeness, especially about the birth registration data that we show you in the last few minutes. So I think that actually we have asked about the household, whether the mother has a child birth registration document or not. And also, we also ask them after they they have registered their child at the registration delivery. And this is we have. I think that we feel that we still have quite limited question. But I don't know how the expert can get the rich information from the sample household survey as well. So that I can say that we are not really, we still need to improve our data collection in the near future.
Okay, thank you. I don't know if any of the other panelists would also like to address this question.
Can I come in?
Yes, Jay,
Hi.
please go ahead.
Yeah, just to follow up on that question. When it household survey data, I think that and having right sample design, and another part is the right implementation. So here, when it comes to DHS and mixed kind of surveys, one is UNICEF supported mix, and another one is supported by US side. These have very good international standards when it comes to as well as the sample. But is the so if the country the survey is taking care of the quality of survey implementation, starting from the training up to the end of the data collection and including the data processing. I think that is where the challenge comes. So the main issue is the non-sampling related issues. That is what posing little bit of challenges for some of the countries. I will not say it is like, everywhere, but there are countries, they are having this problem. So we also have a limitation in terms of, how much we can actually support on a day-to-day basis when it comes to the actual data collection process. So it is not to do with the tools and the sample design part of it. It is mostly at the implementation side. So it is basically the non-sampling kind of errors. That's what comes in. Thank you.
Thank you. Thanks, Jay. And I think we'll go to a question from Tanya, and it's for the speakers who focus on assessing registration completeness using surveys and census. So but if anyone's else has got experience on this, please also jump in. Do you think there is a risk of recall bias using these methods? So where we're asking, I guess, the direct question about registration of events, is there an issue of recall bias? Would anyone like to take this one?
Yes, Petra. This is Sergio speaking. So this is indeed a very good question. The point is, how do you, as I've said that in your presentation, there are specific questions that are core topics recommended by the international standards that should be incorporated in each census. However, in the practice of many countries, we documented the fact that the questions are much more specific, and they do ask about the registration of the birth or the registration of that, and even go to the extent of asking for some kind of unique identifiers for the occurrence of these events. We do have documentation that in certain circumstances this actually works quite well, and then provides a good starting point for assessing the completeness of civil registration. In other cases, there was a confusion about the way that the question was put together and the format of the question, including whether the registration and the birth certificate actually really refer to the same process. So it is difficult to provide a kind of an universal answer to the question. It has to be simply put together within the circumstances of the population housing census, simply because in our experience and then in our documentation, the most important point is the possibility of assessing the completeness of the civil registration process in small areas. That provides a good, I would say, starting point for remedying the discrepancies that might occur, and the census is the one that provides this kind of possibilities. So, in very short, there are different experiences. There are different results. We cannot come up with one overall advice which of this approach is being successful, other than those that are internationally recommended in terms of the fertility and mortality questions in the census. Thank you, and over.
Thank you, Sergeant. And I think one last question, and it's from Iran to Australia. And the question is, have you ever used machine learning techniques for record linkage? And if you could share your experience. So would our colleagues from Australia like to address this question?
Indeed. I would probably actually say that I'm not the right person to answer that sort of question. We have a very large data linkage program that is undertaken, but there's a specialised area of the ABS that does all of that work, and I wouldn't want to go there. I know that there are lots of examples of machine learning work happening, and they may be across agencies as well outside of the Bureau of Statistics. But yeah, I think definitely it's a direction. Probably some of our research arms of government are more looking at those things, but it's a future.
Okay, thank you very much. I think we should probably close now. I know there's some more questions which haven't been answered in the chat, but the presenters will have access to this chat, and so all the participants for I think for a month it remains open. So presenters, feel free please to respond to the questions in the chat, and it will remain open after this meeting, so you can respond to any questions directed at you. And for those of you who are particularly interested in this topic and want to carry on the conversation, we are going to be holding an expert group meeting on Thursday and Friday this week to discuss these issues in more detail and hopefully come up with some recommendations and guidance on the use of secondary data sources. So if you're very interested in joining us, please do get in contact so we can send you an invitation. So with that, I think all that remains is to thank all the participants in this webinar, and to thank again the panelists and discussants who so generously have given up their time to make this webinar a success. And we hope that we'll be able to continue with this work as part of the expert group meetings, and to be able to update everyone with the material that's going to come out of them. So thank you very much, everyone, and I wish you all a good rest of the day.